For David Garibay, being a firefighter, a parent, and grandparent was his life. But David suffered from chronic back pain that affected his lifestyle.
Being a firefighter, you're always having to get up and down, in and out of the equipment, on top of the fire engines, just to go into the cab of the engine, which I was an engineer for my whole career.
When his back pain became too severe to do even the simplest of tasks, David went to his doctor to explore his options.
Talking with Dr. Dimitrov made me very comfortable about him being competent enough to do, and he even recommended that I could go talk to another specialist and compare the findings. My biggest fear was that I'd end up like my sister. My sister had lower back surgery about 20 years ago. She still has to take pain meds. She's still uncomfortable, and that was the scary part for me. Dr. Dimitrov said that 90 to 95% that everything would end up fine. And ultimately, that's what I made the decision to have it done.
Dr. Dimitrov recommended scheduling his procedure at a surgery center.
I first heard about the Monterey Peninsula Surgery Center from Dr. Dimitrov. He expressed to me that he had done several surgeries out of that facility, and I was comfortable with that and told him I'd been to other facilities and I'm sure it would be fine.
According to a patient satisfaction survey conducted by the Center for Medicare and Medicaid Services, 98% of patients rated surgery centers as excellent or very good. Surgery centers can offer patients more advanced technology, less invasive surgical techniques, more effective pain management, quicker recovery time, and tremendous reductions in the cost compared to hospital-based care.
One thing that I think works really well here at the surgery center is the team approach. Because of the small environment and the one-on-one care, we can really focus on what's important, which is the operation at hand and getting the patient through this procedure safely.
Like many patients, David had concerns.
One of the things that I was concerned about was the time feeling better so that I was able to go home. And I expressed to Dr. Dimitrov that I might want to stay overnight. And he said that the surgery center would accommodate that for me if I wanted to. But he said that most people would leave at the end of the day because they felt better. So the surgery center had already expressed that they had nurses coming in to sit with me overnight. I was glad about that because I really didn't know how I was going to be feeling. As it turned out, I felt so good in the afternoon after the procedure that I asked them to cancel the nurses, and I left around 6 o'clock in the evening.
The common scenario is that after spine surgery, I tell people there's about a week to 10 days where they should expect to take it easy and not do full activities. Then for the next 4 to 6 weeks, they recover and get back to about 80 to 90% of their full range of activities. And then beyond that, it usually takes 2 to 3 months, but we generally expect from these types of operations that we do at the surgery center that people are near 100% once all the healing has occurred.
Hey guys!
Grandpa!
Hey, what's going on?
And for David, that meant getting back to his everyday life.
The thing that I really appreciate is the fact that you have a surgery center available so that you're able to go in and get your surgery done and be able to get out so quickly. I realize that surgeries have gone a long way, and I think that the surgery center is probably one of those items that have progressed to a point where they're very valuable. So you're going to cook cookies?
Mm-hmm.
It was a good experience for me, and I'm actually glad that they're there.
For more information, visit www.casurgerycenters.com.